Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. I am a board certified internal medicine physician as well as a hematology oncology fellow who is passionate about educating common folks such as yourself as well as caregivers and patients regarding wellness. I love and it's my absolute passion to help educate patients. I love educating my patients. I am passionate about improving health literacy amongst our communities. And so I'm coming at you with another episode with Real Health Talk with Dr. Coring. Today I would like to discuss chronic kidney disease. Have you or a loved one and or a friend have been diagnosed or even been told that your kidneys are poorly functioning? Have you been told that you have chronic kidney disease? What is chronic kidney disease? Okay, let's talk about it. But before we do, let me give you a brief outline of how I would like this discussion to go. First, I would talk about what is chronic kidney disease. Then I would discuss the most common causes of chronic kidney disease. Then I would discuss the symptoms of chronic kidney disease. Then I would go into the prevention. How do we prevent this disease from progressing? And then lastly, what I really want to discuss today is our diet. What diet should we be abiding to in order to prevent the progression of chronic kidney disease? Yes, there is a special diet for patients who have been diagnosed with chronic kidney disease. All right, so let's start off with the basics. What is chronic kidney disease? Well, your kidneys is an organ located along your flanks or basically near your back. You have two kidneys, right? And what are the role of the kidneys? The role of the kidneys is essentially to filter. The kidneys like to filter things that are not supposed to be in your body, so such as toxins, a lot of medications, drugs. The kidneys really keep your blood clean. That's what it's designed to do. All right. And so, if this process becomes injured or suppressed or diseased, like in chronic kidney disease, then your blood could develop toxins, and that could be detrimental to your body. All right. So, what are the common causes of chronic kidney disease? Well, the top two causes of chronic kidney disease is diabetes, type 1 and or type 2, and high blood pressure, hypertension. These are the top two causes of chronic kidney disease, especially in our community. When I say our community, I'm referring to the African American community. You see, so it's oftentimes that, you see people, African Americans in particular, that are on hemodialysis. Why? It's essentially because of chronic kidney disease that essentially leads to end stage renal disease. And so as chronic kidney disease continue to get worse, then the kidneys totally fail. And that leads to end stage renal disease, which means you have to essentially be on dialysis. Why? It's because if not, then the toxins that I mentioned before can build up in the blood in your body and really cause the body to start to fail. Your other organs start to fail because the toxins are irritating to the body, including the brain, the heart, the liver. And so that's why the hemodialysis sometimes in patients that progress to end-stage renal disease becomes really important. Okay? And so what are the symptoms, Dr. Corey, of chronic kidney disease? All right. So at first, sometimes you may not even have symptoms. Your kidneys may be slowly starting to deteriorate and you may not even know. And so that's why it's very important for us. When I say us, I'm talking about African Americans, our community. It's important for us to get checked. It's important for us to establish a relationship with a primary care physician. Why? It's because we need our labs checked. Assessing the kidneys is essentially measuring a simple blood draw, measuring a few simple things in the blood, and that would be able to tell your practitioner, your physician, your doctor, if you are borderline or maybe your kidneys is more than borderline disease. But it will give us a guide on where you are along the spectrum. All right. And so, what I'm trying to say is the reason why this is important is because at first, at the beginning of chronic kidney disease, you may not have any symptoms. So you may feel like you're doing well. You may feel like your kidneys are fine, but that may not be the case. And so that's why we need to get checked. That's why having a relationship with your primary care doctor, following up with your doctor, getting your labs checked at least annually is a great idea. Okay. All right. So what are the symptoms once the disease progresses outside of the period where you do not have symptoms? Well, the first symptom or the first thing you may notice is swelling. Where? Well, you may have swelling in your feet, your ankles, all right, your legs, and we call this edema, okay? And so if you notice swelling in your feet, your legs, your ankles, it's getting worse. You could touch your ankles, press on it, and there's an indentation left, then that's a problem. That's called pitting edema. And that's, if that were to happen or if you are experiencing that, you should probably go and get that looked at by a professional, a healthcare professional, all right? High blood pressure. Again, one of the common causes of chronic kidney disease is high blood pressure. And therefore, if your blood pressure is starting to increase, even while you're taking medication for it, and it's just, the medication is not working as well as it used to, that may be a manifestation that your kidneys are involved, or your kidneys may have already been involved, you just did not know, and it may be a sign that your kidneys are getting worse. So high blood pressure. Also, fatigue. You may feel tired, all right? You may feel confused. That's also a sign and symptom of chronic kidney disease, being tired, all right? And so and also I forgot to mention, the last thing you may notice is decreased urinary output. You may only pee one time a day when you usually are peeing 3 to 4 times a day. And so if you notice that you're not peeing as much, then that may be a sign of chronic kidney disease. All right, so we talked about the symptoms. And so how can I prevent chronic kidney disease from getting worse, or Dr. Coring, how can I prevent chronic kidney disease in the first place? Well, the first thing you should do is prevent high blood pressure and diabetes, okay? And we could prevent high blood pressure and diabetes by controlling our diet, eating less salt, not smoking, not eating a lot of carbohydrates, exercising. And if you do develop high blood pressure and or diabetes, keeping it under control, taking your medications as prescribed, following up with your doctor, with your doctor's office appointments are very important, because controlling the diabetes and the high blood pressure really, really well can help prevent and or alleviate chronic kidney disease. All right? And we can also prevent the chronic kidney disease from getting worse. That's the main thing here, is preventing it from getting worse. Other things that we can do to prevent the chronic kidney disease from getting worse or developing is medications. What medications are you taking? And the main culprits, medications or the class of medications that can cause or make chronic kidney disease worse are a medication class called NSAIDs. These are pain relieving medications, commonly known as Aleve, ibuprofen, okay, naproxen, Advil, Motrin. These pain relievers can either cause chronic kidney disease and or make the chronic kidney disease worse. Smoking, tobacco smoking. If you're a current smoker and you have been diagnosed with chronic kidney disease, I highly encourage you to stop smoking, because that can make the chronic kidney disease worse. Losing weight can help, okay? And then lastly, diet. Diet is very important to helping to alleviate and or manage chronic kidney disease. Okay, so let's talk about the diet. What First of all, why is the diet important? Well, I'm glad you asked. The diet is important because with chronic kidney disease, the kidneys itself does a really good job of also controlling the electrolytes. All right, electrolytes such as sodium and potassium. And so, if these electrolytes are not, if these electrolytes or the chronic kidney disease, I'm sorry, gets worse, then these electrolytes will start to build up in your body. And that can cause or that can be problematic. And therefore, we advise a diet that essentially helps us to prevent worsening of the electrolytes getting worse. And the electrolytes specifically that I'm referring to is sodium and potassium. That's right, sodium and potassium. And so therefore, it's really important that we abide by a diet that's low, that's right, low in sodium and potassium. All right. And also, a low sodium diet is really beneficial for chronic kidney disease because a low sodium diet, guess what? It reduces hypertension. And so, therefore, a low sodium diet not only helps prevent the sodium from building up in the body, but it also helps reduce high blood pressure. And high blood pressure is really important in controlling and managing chronic kidney disease. Also, potassium. The kidneys help regulate our potassium, and therefore, if our kidneys and our kidney functioning is worsening, then the potassium becomes elevated, and therefore, we highly recommend a low potassium diet and trying to avoid foods that contain potassium or high levels of potassium. All right. And so, what are those foods that contain high levels of potassium? Where there's various fruits that contains high levels of potassium. The main ones are avocados, bananas, and coconut. Also, dried fruits and dates have really high levels of potassium. I love my dates, especially my dried dates, but they have a lot of potassium. So, if you have chronic kidney disease, you may want to stay away from those. Vegetables, artichokes, beets, broccoli, Brussels sprouts, cabbage, all have high levels of potassium. The white potato, okay? It's a lot of food that have high levels of potassium. Proteins like black beans, kidney beans, salmon, lobster, scallops, all have high levels of potassium. All right? And so we want to stay away from these foods, okay? Because we want our potassium levels to stay normalized. Why? Well, it turns out that high levels of potassium is toxic to the heart and can cause fatal arrhythmias and can cause your heart to stop. Okay? It's very important. Phosphorus. Foods that are high in phosphorus should also be avoided. Phosphorus is also regulated by the kidneys, and as the kidneys continue to get worse, the phosphorus levels would increase. So foods such as dairy products like milk, nuts, also beans, liver, chocolate have high levels of phosphorus. So low phosphorus diets become really important in patients who have chronic kidney disease. Okay? And so it's very important that we understand the foods that we should be eating and should not be eating when diagnosed with chronic kidney disease, essentially to prevent the worsening of chronic kidney disease. All right, so it's very important. Talk to your healthcare provider for more information. You can also do a quick Google search on foods that have low sodium, foods that have low potassium, foods that have low phosphorus, okay, to help prevent the worsening of chronic kidney disease. The low sodium diet is really important because it also helps prevent hypertension. All right, so just to recap, today we talked about chronic kidney disease and we talked about what it is. We talked about the most common causes, which is diabetes and hypertension. We talked about the symptoms. At first, no symptoms, and then you may notice leg swelling, tiredness, fatigue. You may even notice palpitations as well if your potassium levels are high. That's something I wanted to warn you guys about. We also talked about how to prevent the worsening of chronic kidney disease once you are diagnosed. Talked about controlling the high blood pressure, controlling your diabetes. We discussed losing weight, stop smoking, and also your diet, the different diets that we have for patients with chronic kidney disease to prevent worsening. Low sodium diets, low potassium diets, low phosphorus diet. All right? That's my time, folks. I hope you got something out of this. I think the best takeaway here is if you were diagnosed and have been diagnosed with chronic kidney disease, it's good to control what caused it in the first place, which is likely diabetes and/or hypertension. And also, it's good to abide by the diet, the necessary diet to help prevent the worsening of chronic kidney disease. And also medications, staying away from pain relievers such as NSAIDs, such as ibuprofen, Aleve, naproxen, Advil. Those medications are a no-no if you are diagnosed with chronic kidney disease. That's my time. I love you guys. Peace. Oh, don't forget to subscribe. Bye.